Hello guys, welcome back to my YouTube channel. My name is Nick and I'm back again with another video, and it's about how to pass your nursing interview for UK nursing. I'm gonna say it's going to be a lengthy video because it's quite detailed, and I really need you guys to get exactly how the interview process is, and I'm sure you're gonna enjoy it. So let's go for it. So I'm going to start with preparation, and preparation for the interview normally entails just basically your environment as a person, because the interview is online, so you'll need to be in a very quiet place, preferably your home. So on that day, ensure that you've got stable internet, stable power supply, and ensure your devices are all powered up. And I would prefer a laptop, and ensure that its connectivity, it's really nice to ensure that there are no like issues when it comes to you relaying your information to the other party on the other side, because the interview takes roughly an hour. So ensure you've got very stable internet and power supply. Then ensure that you're in a quiet environment, and also on the day of interview, ensure you're quite settled. I know sometimes you experience some anxiety here and there, but trust you me, just compose yourself. Is like I normally term it, is like a formal conversation. It's like having a chat with your colleagues at work. It's very different from the interview setup back in our country, that is Kenya. It's more of a chat. You just enjoy it, you laugh during the interview, it's just fun. So just relax and be ready for everything in terms of the interview. So they're going to talk about your skills, so proofread your CV before anything you write on that CV. They're gonna ask a question about it, so just go through your CV. That is actually the marking scheme, your CV. They're gonna talk about some things you learned during your CBT preparation, and that is the 6 C's. You know, the 6 C's. And they're going to talk about NMC code, and they normally use this phrase: give us a scenario where you had to prioritize a patient. Give us a scenario where you were compassionate to a patient. Give us a scenario whereby you are communicating. They are not going to ask you directly the C's. They're going to tell you, give us a scenario. So have some scenarios in place. I know even without having to tell you to plan, we have experienced all this kind of stuff during our nursing as a profession, in our encounters with different patients here and there in our wards. So I'm pretty sure you've got quite loads of scenarios whereby you had an exposure with the 6 C's. And the 6 C's can both apply in the NMC and also or the NHS, because the 6 C's, apparently they are the core values of the NHS as an institution. So ensure that you're quite aware of that, and the NMC code of conduct. And after you've done all that preparation, now on the day of interview, ensure there are no disturbances whatsoever, like interruptions. If you've got kids, ensure that they are either at school or you found a way of just keeping them away for an hour to ensure that your interview is way cool when you're doing it. And also things like the deliveries, guys visiting you at that time. So ensure you're in a very quiet room, because they prefer a situation whereby you are able to talk to one another and communicate, because doing interviews online is not an easy task, because they normally place a lot of protocols, logistics in place to ensure that interview goes on as planned. So Just do that and you'll be good to go. So guys, I'm gonna like go direct to the questions. I've got prepared questions of during the time I was doing interviews, some question I encountered. I'm not saying you'll get them during your interview. I'm just giving you a leeway of how you can answer them in a better way and help you secure a job in the UK with the NHS, or if you're applying for the care homes or the private sector hospitals, because trust you me, you will not miss one of these questions during your interview. They are very basic, simple, but for you to pass that interview, you really need to have the right information. So I'm just giving you a leeway and use that information wisely. I'm not saying you copy and paste what I'm just going to say here, but just use it wisely. It's going to help you. So the first question is, I'm gonna be reading. I've got a booklet. I've just written the questions. So tell me about yourself and what triggered you to be a nurse, or what inspired you to be a nurse. And this basically goes to you as a nurse. When did you start your nursing journey? When did you start your nursing journey? So just start from the first day in your nursing school all the way to the date you graduated, the first place of work, all the way to the current place you're working, and give a detail of the experience and the profession or specialties you've acquired during that period of time. So you might have graduated as a nurse and specialized in maybe renal nursing, ICU nursing, PICU nursing, NICU nursing. So ensure that you give a detail of the specialties you have and the achievements you've done during that period of time. They don't want information about your biodata, your age, all that kind of stuff. In this other side, they don't care about that. So just be direct to what the question asks for. Just be direct and you will pass your interviews in a very nice way. Then definitely, like they say, nursing is not just a career, it's a calling, it's a vocation. So there is something at the back of your mind. When you sit down and reflect back, there is something which triggered you to be a nurse. So use that scenario or that happening to be your background when it comes to the things which inspired you to be a nurse. Maybe something happened to you as a person, or to your family member or a friend, and it triggered you to be a nurse and help people who are going through illnesses in the community to be better people. Just as simple as that. Next question. Why do you want to work for this hospital? Again, the answer to this question is tied to the first question. Go back to your qualifications, the kind of experience you've got, the qualifications you have, and translate that to the kind of positive impact you bring over to the other hospital. That question, what do you want from your next career move? And this goes way back to the day you started your nursing journey to come to the UK. What really triggered you to start that journey? At first, you can say something related to your career, maybe something like career growth or working in a dynamic environment which helps you to deliver a quality nursing care, because the quality nursing care is very important for our profession, because you guys really understand what we go through working in an environment whereby you do not have like quality or enough supplies, and you have really to be creative to ensure that you deliver your care. And at that point in time, you compromise your safety and the patient's safety, which is very, very important. And then lastly, you can talk about salary. Definitely that will be the last thing, because they already know that. So tell them about something else they don't know, or something else in your perspective. It's going to really help you. And next question, what areas of specialty are you interested in? This is a very, very important question of your interview, and it majorly entails you as a nurse, and it just direct which areas maybe have you specialized in, or if you've not specialized in, you would want to specialize in specialized in those areas, because these guys normally place you where you are passionate, like where you feel like you are home, you're going to deliver care at your best. And it really helps, because they're going to have what we call practice development nurses, who guide you all the way to ensure that you specialize in that area, and they make absolute use of you in that field, because you are passionate about that career move, and you're passionate about the department you're working in, which will translate to results and providing quality healthcare to their patient, hence improving the standards of the hospital. So they just don't place you anywhere. You have to be absolute honest where you want to work in. So be direct at that point in time. I know at this point in time there is not really much you can do, because already during the application you knew which position you're applying for, but it's important you be honest at this stage in time, because they can always do change your department. Yeah. Then the next question, where do you see yourself in the next 5 years? This is a personal question, and it's all dependent on your qualifications, or where you're at that point in time, if you have a diploma, degree, or you've done your master's. So just be realistic and be smart when you're making your decisions. Don't give ambiguous goals. They're just asking your long-term goals to see if you're able to plan yourself career-wise, because it's very, very important, because here they do a lot of evaluation based on your qualifications. So ensure you give realistic goals. Don't set goals which are unachievable within this 5-year period. Just be honest to yourself and what you can do at that point in time. And that's it. And next question, what are your strengths and weaknesses? This is a very simple question, but the problem is a lot of people lie at this point. When it comes to strengths, it's very simple. Just go to your CV and be familiar with the skills you have. You can use them as your strengths. But for the weaknesses, definitely you cannot be perfect. There is always something about you which is not okay, or yeah, you're just there. You're not like 100% okay with yourself. So just mention one. Because if you fail to mention, it means there is a chance you do not have what we call self-insight. You cannot sit down, evaluate yourself, and judge yourself, which is very, very important. It's very, very important to have that self-insight. So you know your weaknesses. Just mention one. That is it. Just be direct. And what are your areas for improvement? This is just an add-on on the previous question, and they just basically asking you, if you know you've got this weakness, what are you doing at the moment to improve your weaknesses to become your strength. That is basically it. If you know you are not a good time manager, what are you doing to help you manage your time much better? And what are the things which are triggering you not to manage time well and manage them? Basically, that's it. Then the next question, would your previous colleagues recommend you, and what would they say about you? So this is a very important question, and they're just basically trying to get as much information out of you as possible. And this question always gets you in a very awkward position, because in every workplace you work in, you will not always be friends with everybody. You're gonna rub shoulders with other people. You're gonna have real friends and people who can help you in your career. So that is basically the truth about it. But they just want a general picture of who you are at work. How is your relationship with other staff, with patients? So if asked that question, will you say it in a very natural way that you are good at work, you're not having issues? That is basically what they want to know about you. Just be simple, direct. Then, how do you keep yourself up to date with the changing nursing standards and guidelines? As you all know, nursing is a very, very, very dynamic profession. And for you to renew your license, you have to undergo some training, which is continuous, to ensure that your competencies are up to date. And this applies to different countries. Personally, in a country that is Kenya, they've got a website which is tied to the nursing body in our country. And basically, you do courses, you get certifications, and you get what we call CPD points. So for you to renew your license, you will need, I think, 40 CPD points for you to be able to renew your license. So use that information if in your country you've got such infrastructure in place to help you answer that question correctly. The other thing you need to do is something like universal websites like UpToDate. UpToDate is basically used everywhere. It's a very nice website. You can have basically information on everything you need in nursing. So yeah, you can basically use UpToDate if in your country you do not have those like in a website or infrastructure in place. So yeah, that is the best way to go about it. Then how do you deal with stress? I would say nursing is one of the stressing jobs you can ever like work in or be in, or it's just a crazy environment, because it's an environment which requires you to be at your absolute best, even in moments of adversity, even in moments of very, very severe like life happenings, and you have to be strong for other people and support them at that point in time. But how do you deal with stress when at that point you reach your breaking point or you are not able to take it all? So find a way. This is a very, very personal question, so just be honest to yourself. How do you deal with your stress? And they just want to see the natural you. Don't fake, don't create answers, don't be a clone. Be yourself at this point in time, because everybody has this point in time whereby you cannot take it. And how do you deal with that? It's very, very important in nursing as a profession. So yeah, I would say that is the best way to go about it. Look in your like working environment, the kinds of things you deal with, and with the best way you deal with them, especially maybe at work. If you got maybe stuffs you like you're not able to interact well, such kind of stuff, how do you deal with that? So that is an example. So use as many examples related to you as a person and use them as examples, because they just want to see what you go through and how you do like with them, because in this interview they are more of, can I say, more of scenario based. They're gonna need an example with every single answer. Yeah, almost every single answer. They just want to get details about what you go through. Yeah. What does teamwork mean to you? Basically, teamwork is a group of qualified professionals who come together with same task in mind and put all their energies together to ensure that they achieve their goal as the end game. So look at it like in hospital, we've got nurses, doctors, physios, pharmacists, lab techs, phlebotomists, and all these guys work directly to ensure that the patient gets better. So basically that's teamwork. Simple as that. What does accountability mean to you? Accountability is an act of taking responsibility of your own actions. So if you are involved, for example, in direct patient care and something happens to you, or you've done something when helping a patient and maybe things did not go well, are you strong enough to admit it? You did this. So that is accountability, being responsible of your own actions. And the next question is, how do you deal with stuff at work, or what is your leadership style? This is very, very important, because they are just testing your leadership skills, and they can give you a scenario at this point in time. They give you a scenario, maybe you've come to work and this happened and this stuff is involved, or they take it as you've seen something happen, or you've seen another staff do something which is wrong to the patient. What would you do? This time they're just checking your integrity. So ensure you really answer that question in a very thoughtful way, not trying to prove a point to the other nursing officer or staff nurse involved, but to help them become better, and at the same time protecting the patient or ensuring the patient's safety. So that is a very, very important question. So be very careful on how you deal with such questions. And the next question is, why do you think providing basic care to patients such as assistance with personal hygiene is important part of you, or is important as part of your role as a nurse? Just sit down and reflect. This is basically the role of you as a nurse, your roles and responsibilities. And I'm going to give you an example. Like, let's say, for example, you come to a shift and you find your patient in a very, very messy state. And maybe you've been handed over from maybe the day team or the night staff, and the patient is in a very, very bad situation. Maybe they are not clean, they've opened their bowels, and they cannot help themselves because of the condition. And you decide, okay, I'm not gonna do the changing or cleaning them up just because the day team or the night team left them like that. Is that okay? Is that okay? No. And how is it going to affect that patient as time goes by? If that patient stays in that condition for long, they're going to have what we call pressure sores, because they have been exposed to moisture for quite a long period of time, and it's going to affect the overall process of taking care of that patient. So is it important to do the overall nursing care of that patient? Yes, it is, because if they are cleaned up nicely, they are fed in time, their medications are given in time, definitely it's going to have an impact on their healing process, which makes them stay in hospital for a short period of time and improve their quality of life. So think in that road. And then apart from all these questions, the last part is very important. They normally give you scenarios depending on the department you're working in. So if you work in, for example, in a maternity department, they can give you a scenario: manage this patient has got maybe eclampsia. If you're in medical department, they can give you a question like diabetes or DKA, a medical condition you manage, and they give you figures, you work it out. If it's surgical, they can give you preparation of patient in theater or observation of a patient post-procedure, and they are quite specific with the procedures. They give you a very specific procedure which requires you to do certain stuff which are quite direct to the patient, and if you fail to do that, means you're not doing everything right. So be ready for like a department related question, which is more of a scenario. So they just want to see how you're going to manage it. Critical care, they do normally ask for, mostly they do ask for something to do with CPR. So ensure that your BLS, SELS is all the way up, and ensure your management for heart conditions is also up to date, because they can give you a scenario, maybe an MI, heart attacks, such kind of stuff. So yeah, ensure that all your information on your BLS, SELS is up to date, because they just want to see your prioritization. Dr. ABC, ABC, that is the order, ABC, and what you need to do at that point in time. And remember, if it is an emergency, first thing you do, call for help. Help is important, because you cannot do it on your own. So basically, that's it. And trust you me, if you go through this video, you're gonna pass your interview. I'm not saying you get these questions, but use it as your backbone when you're getting ready for your interview. And I'm sure the next time we'll talk, you'll be on the other side, having signed a contract and yeah, working for the NHS. So I'm looking forward to welcoming you all to the UK. Yeah, it's a nice place. Come, we take care of these patients and chop life. So for those who have not subscribed to my channel, remember to do so. It's Nick the Night Nurse. I'm gonna leave the link down below. Bye bye.